fellow acupuncturists. I'm Dr. Michael Corradino, the creator and president of the Neuropuncture organization. And Neuropuncture is proud to announce that we are an official training partner for FDA-approved electroacupuncture devices by Pantheon Research. And right now, I'm going to give you a tutorial on the wonderful FDA-approved for electroacupuncture 8C.
Okay, so let's get through the tutorial on the Pantheon Research FDA-approved BWK for electroacupuncture 8C Pro. This is a real nice device. It's very small, nice to carry on traveling, as well as keeping it in the clinic. You can put it on the side of a patient, and it fits really nice on treatment tables. Okay, so let's just take a look at this in the front. This is our front panel. We have 4 blue or purple knobs in the front right there that controls the amount of stimulation that the patient will receive through those particular channels. We have a calibrated timer right there. We have our mode switch right there, and then we have 2 microprocessor calibrated frequencies. So our frequencies are spot on and extremely accurate. These have been tested, and I've seen the accuracy in them. When this is on 2 hertz, you're getting 2 hertz or maybe 1.9999999 hertz, but it is very accurate, okay? So this is the front mode, and we'll go through all the specificity of that. Here's the back, and on the back, what we're gonna see is the 4 channels, and there's 2 outputs for each channel. And if you cover up this clip test, you'll see that the 8 channels are right there, and that refers to the 8C8 channels. So each one of these 4 knobs will be communicating with these 2 channels or these 2 outlets. One is milliampere and one is microcurrent. And again, just be mindful that you do not make a mistake and put this accidentally in the clip test. That happens. That's very common. Not to get upset over it, but you may think it's in channel 1. And then when you turn the device on and you're trying to see if the patient is feeling the E-Stim and they don't feel it, and it's all the way up on 6, you look, oh, it's on clip test. Okay, what you want to do is definitely right there, turn the machine off, then turn it in its accurate channel to then perform the treatment. Okay, so now on that note, let's talk about some of the safety measurements and some of the safety mechanisms that Pantheon has installed in the 8C. The first one that's very, very important is the diagnostic red beeping sound, which we are all very familiar if you use the 8C. So now you should all become very familiar with that sound. I know all the acupuncturists and physicians I work with are very attuned to that sound. So if we hear that anywhere in our clinic, we're going to know that we have to go check on that device. That is going to mean that the machine has stopped working. The machine would stop working for 3 possibilities, right? It could either stop working because maybe the intensity knobs were already open. So let's say you or maybe a practitioner before you left these on because let's say they finished the treatment and they just turned it off. And then you come in and you set up your needles and you put the leads in the proper channel. You connect these leads to the needles and then you set the proper parameters, you got the timing down, and then you go to turn it on. These were on, sometimes maybe they were on full. That would have elicited a charge and shocked your patient normally, but the Pantheon has a safety mechanism where that will not happen. So if these are ever accidentally left on, you will not turn the device on and shock your patient. And that is a very, very helpful safety mechanism. So that's one. If the machine is turned on and you don't know that and you turn the machine on, okay, that will beep so you don't shock your patient. When else will that light go on and the machine turn off? When the timer is up. So if you put your timer on 30 minutes, 20 minutes, or 10 minutes, sometimes, yes, I'm doing 10 minutes of stimulation of just E-Stim. Sometimes I want 20, sometimes I'll do 30, usually nothing over 30. So what I'll do is I'll just keep this on 30. Sometimes practitioners before you may bring everything down and they'll turn all the knobs down, and that includes the timer onto 10. And if you don't check that in the middle of your treatment, 10 minutes in, you're going to hear that. And that's going to tell you that the timer went off. And you're going to be like, oh, sorry, you have to turn that off, turn everything off, put the timer on 30, and then restart the treatment again, okay? So that, again, diagnostic light can go on if one of the intensity knobs is accidentally opened up, if the timer is off, or if the battery dies. And that's another great safety mechanism that John installed in the Pantheon devices, and all of them have this, so that when the batteries cannot supply enough energy to come out of these channels with the proper parameters that was programmed, then the machine will turn off. If we notice in other devices, sometimes as the batteries get weaker, we have to turn the intensity up for them to feel the same sensation. That's not necessarily safe, and that's not good. You're changing voltages and other parameters in the stimulation. So it's best not to have those types of devices. This will shut off once it cannot produce or perform the duties that we are asking it. And again, you'll hear that sound. Big sound you always want to know, okay? All right, so that's the diagnostic light. Now, this is the timer. Here's the mode switch. So when we want to use a continuous frequency, okay, sometimes these knobs do get a little stripped. It's not a problem. There's a little screwdriver, little screw right back there where you can just loosen and tighten it. Make sure the dot is on the proper setting so you don't get confused. That's not a big deal. But if you want to use continuous, what you're going to see is it's going to be this knob down here. Again, these are microprocessor calibrated, so they are very accurate. So if we put this on 2, this pulse light right here is going to pulse at the frequency in which it is set to. Now with the camera and the light, sometimes this is hard to read through a camera, but in live time, you'll see this blinking exactly at the rate that the frequency is set to. That's continuous, which means all of these channels will be eliciting a 2 hertz frequency. If you put it in millicurrent, it'll be 2 hertz millicurrent. If you put it in microcurrent, it'll be 2 hertz microcurrent. Make sure you don't put it in the clip test. Okay, what if we want to use 2 different frequencies? Well, then we can use either discontinuous or we could put it on mixed. Now, in neuropuncture, we use a lot of mixed. Mixed and discontinuous are the same in that they'll be switching back from these 2 frequencies, okay? And the difference is the time interval between the 2 frequencies. Discontinuous is going to deliver those 2 frequencies at 2 different time intervals, and mixed will be consistent through those time intervals, but at the same frequencies, okay? So 2 to 100, you can see the light blinking at 100, and when this is on 2, it's blinking at 2 hertz. And then it goes back to 100. Now, keep in mind, whenever you are using a mixed frequency in neuropuncture, what we teach is that you increase the intensity knob only on the higher frequency. And then we would stop when it goes to the lower frequency so we don't shock our patients. And then we can increase it again. And once they feel comfortably strong, we leave it. And as it revolutions through the 2 different frequency settings, patients should be comfortable. Okay, so that's mixed, discontinuous, and continuous. Again, microprocessor calibrated. We could turn this off, and then we could also now have the opportunity to do some testing on the machine. The first test we can do is we can test the battery. Let's say you think the battery is not working. Well, then what you want to do is you want to clip it to the battery test, and you can't go past it and go back. So 1, 2, 3, 4. So you put that on the battery test, and then you'll see the diagnostic light green will go on, which shows that the battery is good. If the battery wasn't good, what would we see? Remember, we would see this light. Okay? So if the battery was bad, you would see that. The battery is good, you'll see green. What's this up here? This is the output test. Let's say over the time using the machine, you start to maybe recognize that maybe one of the channels seems to be possibly not working. Let's say for some reason, channel 1, patients never feel a stimulation. And you've witnessed this a couple times, so you want to test it. So you put that in channel 1, the lead, and then right here where it says output test, we're going to clip the clips. And now that is sending the signal from the channel to the output test. We're going to put the machine on. And then what we're going to do is then turn the channel on that is being tested. Okay. And what we should see is the diagnostic light go on. And it's hard to see again in this setting, but it's going on. Okay. Then what if we want to check the actual lead itself? So sometimes what will happen is the channels you may seem to have a problem with maybe one of the channels. It could be the battery, or lastly, it may be the lead. And if it's the actual clips, you think that something's wrong with the clips, which happens because there's little fine wire filaments there, you could test the clips. How do you test the clips or the leads? You put it in the clip test, clip the leads together, and then you're going to turn it on. Whoop, see, that was on. That's why I turned off. Good. And then we're going to put that on, and we're just going to wait for the battery light to test on. Diagnostic green, just like before. I think you could see it in this one, and you could see how that's working. Okay? And that is the output test, the battery test, and the clip test. Okay, that's for the Pantheon 8C. Millicurrent is on top. We use that for more pain management, and microcurrents more for tissue repair and inflammation. I hope you enjoyed that. Please check out the clinical pearls below and further your training with neuropuncture. Thank you.